COVID-19 syndrome in children rising. Cases more severe than first wave. Last year, doctors found an odd type of inflammation among children with COVID-19. They identified that many body parts were inflamed, including the heart, lungs, kidneys, and brain. The inflammation prompted scientists to investigate because it could affect major organs. That said, some pediatric patients developed gut pain, vomiting, diarrhea, and neck pain due to systemic inflammation. At that time, the inflammation was linked to Kawasaki disease, another inflammatory disorder in children, but later distinguished as multi-system inflammatory syndrome in children, or MIS-C, exclusively associated with COVID-19. Recently, reports showed the rising MIS-C cases in the US, and experts have no idea why. When the disorder came to light, it was classified as rare science. Not all pediatric COVID-19 patients develop systemic inflammation. Although it is still a rare condition, the US CDC can't ignore the apparent trend. As of February 8, the CDC tallied 2,060 cases of MIS-C and 30 MIS-C-related deaths. The cases were reported in 48 states, New York City, Puerto Rico, and Washington, D.C. Based on available data, most MIS-C cases involve children and teens aged 1 and 14 years, with an average age of 9 years. Furthermore, 69% of reported cases were either Hispanic or Latino, or Black non-Hispanic. About 99% of the cases tested positive for the COVID-19 virus. The remaining 1% was determined that patients were around someone with COVID-19. Thus, none of the MIS-C cases was connected to another infection. Here's the biggest concern. More patients are sicker from MIS-C compared to the first wave in 2020. Dr. Roberta DeBiase, Chief of Infectious Diseases at Children's National Hospital, said, "We're now getting more of these MIS-C kids, but this time, it just seems that a higher percentage of them are really critically ill." When that hospital fought the first wave, approximately 50% of all patients required treatment in the ICU. Now, about 80% to 90% of MIS-C patients needed treatment. That spike indicated the increased severity of MIS-C in children with COVID-19, and reasons are still unclear to experts. The only indicators they have noticed are the recent winter holiday season and the new variants. According to the New York Times, no evidence yet suggests that the new variants are responsible for the case surge. While they are looking into that, doctors have immediate concerns about the after effects of MIS-C. Since it's a new condition, doctors are unsure whether the condition will lead to heart problems and other issues later on.